Well, it's peak summer season and the sun can quickly take a toll if you're not careful.
We're getting some important tips to beat the heat today from GBMC's Dr. Jeffrey Sternlicht. Good morning.
Good morning. How are you?
I'm great, thanks. But this really is, we need to talk about it, especially now that we're in the middle of the summer and, heat-related illnesses, heat stroke, heat exhaustion. Tell us how this all just starts.
So it's a combination of your body not being acclimated to the heat. So we see this earlier in the season. And it's based on your level of exertion, the temperature, the humidity, and the time of day.
Okay.
So you put all those together and your body just can't compensate for the amount of heat that you're generating and the heat in the environment.
Go ahead. So heat stroke, heat exhaustion, what's the difference?
So it's a spectrum, and heat exhaustion is lower on the spectrum.
Okay.
Heat stroke is the most serious. Heat stroke is a medical emergency. So heat exhaustion is basically your body starts to decline as you're becoming more and more dehydrated and not able to compensate for the heat. So you start to get nauseous, short of breath, cramps, dizzy, things like that. Heat stroke is the most serious aspect. So that's when your temperature goes above 104 degrees Fahrenheit, and then you get neurologic symptoms, meaning confusion, agitation, loss of consciousness, and that's a medical emergency, and 911 needs to be called immediately.
Let's talk about, though, with those warning signs. I was just saying, I'm always around athletes, and you're not necessarily face to face with them to maybe notice some of those signs. But when they're on the field, what are some of those signs that you're like, they need to come out and get checked out at least?
So if you're watching somebody on the field and you notice they're becoming more clumsy or slower and losing coordination and things like that, they need to come off and get hydrated and rest and have an assessment. A good team will have a trainer and so forth around to assess the athletes.
So how can we prevent it before it gets to the point where it becomes dangerous?
So the number one method to prevent it is acclimatization. So your body, just like working out, gets used to the heat. It takes about 2 weeks. But start going out in the heat and exercising in smaller doses and so forth, and then your body, your physiology will change and will make you stronger for the heat. So it takes about 2 weeks to do that. Number two is hydration. Hydration before, during, and after, because dehydration is a common factor in all of these. And third is just taking breaks. And when you start to feel symptoms or you notice somebody feeling symptoms, get out of the heat, get some hydration, go into an air conditioning building if you can.
What are some of the groups that are really susceptible to all of this?
So in the emergency department, the three groups that I see the most of are athletes. So this includes high school athletes, football players, particularly in the summer when they start training. Anybody doing endurance sports, cyclists, runners, hot, humid days, we see a lot of that. The second group we see are outdoor workers. So these are people like postal employees and so forth that are out all day in the heat. Again, early in the season we see this. And third is the elderly. So somebody above the age of 70 or so, if they're working outside in their yard or things like that, they're much more susceptible than younger people.
Got it. All right, well, we have a website up on the screen to learn more information. And of course, if we need help, GBMC is always there.
Correct.
All right, thank you so much for joining us.
Thanks for having me.